Hello. Yay. Can you hear me?
Yes. Hello. Hi.
Oh, hello. How are you?
I'm good.
Oh, thank you so much for doing this for me and helping me with my project. I really appreciate it.
I'm very excited for you, actually.
I'm excited too. Cool.
Yeah. So the you so this is until like maybe the 30 minutes interview.
Yes, it should be around there.
Excellent. Excellent. So
Yeah.
you said that you're gonna record this one and then maybe you send me later.
Yeah, sure. I can do that. Yeah, it's recording right now. So I will send it. It might not show up on your screen, but it says it's recording on mine. So
Thank you. I'm so excited.
yeah. Should we get into it?
Sure, please.
All right. So I saw on your website you have trained at a few different universities. So South Balo University and American Liberty University, and also the Kalish Institute. Is that right?
So the I graduated from the South Bay Law Master program. Actually, I'm engineer.
Oh,
So
okay.
I graduated my college at the Korea, and then I went here South Bay Law and American Liberty University. It's like a PhD program.
Hmm.
But also I went to Harvard as program too. So I went there like a special training.
Wow.
And Cedar Sinai is the hospital at the LA, and I had the orthopedic program. So I had a I learning is always my never-ending passion, and I love it. So I went quiet place actually. So that was all exciting moment though.
Oh, that's
Especially the one at the Harvard program was just phenomenal because it was for MD program, so the physician program.
okay. Yeah.
So
Wow.
that time I realized just we had a maybe 67 attendee for 1 year program, and they come from definitely in America, but there's like a Canada and then even far away.
Wow.
And then that time I was only one acupuncturist. They were MD or DO, and we had a lot of like we had a couple actually dentists as well.
Hmm.
But anyhow, that like I get along and just learn about what like a Western medicine or like a medical doctors seeking in this alternative or holistic medicine. Actually, a couple colleagues actually they stopped doing medical practice and they just only practice actually acupuncture at this time.
Huh. Wow.
Interesting.
Did you say so you learned some about Western medicine there too?
That was a more towards a traditional, actually Japanese style and then Chinese style Asian medicine.
Okay.
The Harvard doesn't. We had actually to refresh the anatomy for even medical doctor because they already like studied a long time ago. A lot of colleagues, so they had some huge anatomy part,
Hmm.
but more the mechanism of this acupuncture and then how body pursue the signals, and so it's more deep understanding of how acupuncture might work. That was our study a lot.
Okay, cool. Wow. Did you get to practice on patients and like um, internship anywhere either?
I did, yeah. That was actually part of now the acupuncture school program.
Mm,
So you have to have like at least like I believe it's. I think I did like a year and a half, almost 2 years, and now the acupuncture school they have very similar curriculum, and then actually it gets more even longer. It's a very extensive internship, and I had a university. We had a internship program in there, so I didn't go to specific other clinic at the time, but
okay.
no, we had a very there's a lot of us. I was a student intern, yeah, for a long time.
Wow, that sounds so cool. That's wow. That's tough. How did you get interested in acupuncture?
This is kind of our family stuff.
Oh,
My great grandma, she was medicine woman. I don't know what you call it. Not really shaman,
okay.
but she's very popular in the her town. So I'm always hearing about my mom and grandma talks about like at the middle of the night, and then the sick people they bring her to her backyard.
Wow.
She does all kind of some special manipulation and then herbs, and then so I kind of grew up with that.
Mm,
And but I didn't really turn into this medicine part because I was an engineer, but I
mhm.
was a chemical engineer at the time.
Okay.
And I love science. I love science, but I realized chemical can be really harmful as well.
Mm,
So unfortunately, after I graduated, I decided maybe I'm gonna change because the I saw a lot of the side effect of the chemical
yeah.
in general as the student. So, but I love the medicine, especially I love herbs.
Mm,
I love acupuncture. Don't get me wrong, but I love like herbology. So
yeah.
half of Chinese medicine or the holistic medicine, half of it is actually herbology. So I
Mhm,
start from learning more about the herbs, and then later I love the acupuncture as well. So
mm,
kind of my like a dream when I was a very little kid. And then the irony is actually I studied Chinese medicine in America. My
yeah.
real training actually happened here.
Mhm.
So that it's everybody think, wow, that's a kind of interesting because I'm from Asia. Why you studying Asian medicine in America? Because actually, I love to come to the America as well.
Mhm.
Yeah, so it was a perfect place to study.
Wow, that is so cool. I love that. Um, yeah. So, Chinese medicine, I understand you practice acupuncture and you use herbs too, and I'm sure different treatments. So, could you talk about what you consider Chinese or Oriental medicine to be, just in general, or what you consider it to be?
Um, the now we use a lot for actual here. I think people's understanding that our patient they focus on a lot of preventive medicine.
Mm,
So acupuncture and traditional medicine is more like a whole person approach. When people coming from the back pain to exact condition of a patient coming, but our treatment can be totally different because
mm,
of other baseline of health or other problem they have. And then we're looking at the original problem is different. So our point might totally different or might similar, but probably not same. So that's what the we approach is still heavily pain management like in our patient. Like let's say half of our patient is more like a pain tours.
mm.
So with the pain management, but after their suffering is getting better, then we always try to see why you have this problem.
Yeah.
That is a very important question. Why you have this back problem?
Yeah.
And then people doesn't really see it as, but we try to then more go over their postural or their eating habits or their lifestyle, and then we try to do more a little bit of a preventive side of treatment. We're not just ending with their pain management. Make sense?
Hmm. Yeah. So you try to help um, treat them so that you can pretend or prevent future illnesses or pains from rising up again in the future.
Correct. And then when people coming at the initially, they thought, oh, I only have a back problem. No, they
Okay.
have a lot of other problems they don't realize.
Mm,
Yeah, other people have, oh, I have a headache or I have a PMS. And, everybody has a PMS. So
mhm,
they think that's all normal. But no, we say that's not normal. It's just common condition people have. But we should look into it. And if you want to improve, and then we can have some method we can help. And then people actually try some like a more preventive measure with the Oriental medicine.
hmm. Wow, that's so cool. So how does how does would you say your practice is more focused on specific illnesses that patients tell you about that's wrong with them or that you find, or um, do you work to help their whole body and their whole health with your practices?
Probably the we do more like a whole body approach,
Mm,
but I I don't want to just okay, your back problem is this, but it comes from let's say your kidney problem. So let's fix kidney. No, I always looking at their symptom as well. We have to relieve those of their suffering as well, and then why this problem happened to people. So more like a root cause, and I think you should treat it at the same time. If you try to address their like a root cause, then they will still suffer. Then I don't serve them well. So I have to relieve what they are presenting at this time
Mm.
as a symptom. Maybe can be people with a depression, anxiety, or gut problems, or PMS, or pain. I'm still addressing that branch problem. We call it branch problem.
Mm.
If they have a root cause problem, let's say their blood sugar management, their blood sugar regulation is an issue, or they have ongoing inflammation, or they have some other issues, then I have to treat it at the same time. So that actually make a more complete treatment in my view.
Yeah, yeah, that makes sense. Um, do you ever do you get patients that ever come in for like stress or their mood or things like that?
So many. Welcome to Newport Beach.
Mm.
Welcome to the pandemic here.
Yeah.
Seriously.
Okay.
So I work with a lot of concierge doctor at the Newport Beach area. So I work with actually medical doctors. Our practice is a little bit unique.
Mm.
So most of our patients coming from the doctor's referral.
Okay.
And when I talk to all this like a primary doctor or internist,
Mm.
they said in Newport Beach, to where I am practicing now, I have so many patients with the anxiety problem.
Yeah.
I mean, there's depression coming. I mean, we definitely seeing a lot of depression issues here, but anxiety in Newport is just so high. I think I'm
Mm.
more competitive. I don't know. It's something. So we see a lot of patients with those mental issues
Yes.
or just like a panic attack. We have a probably at this time like a good 10%. It's not a huge number though. But if I include a sleeping problem due to their anxiety, like a insomnia patient, it will go like maybe 15 to 20% of our patient
Mm.
that emotional factor. But and then they have other problem together. They
Mhm.
have a I have a one patient. She has a more like a headache, and then maybe like anxiety issues and neck pain. So they're kind of coming together. And then one part of the problem is actually anxiety too.
Okay. Yeah, yeah. I definitely agree that there is a lot of mental health issues in Newport Beach that people like anxiety and all of that. It's definitely
Sadly,
common. Um, and then one more question in this area. Do you treat like more in your own practice, do you more commonly treat like acute disorders like a broken bone or something that just happened like recently and like kind of fast or more chronic things like reoccurring pains that people have?
more chronic.
Okay.
Probably more than 70% is a chronic, but we have a still like a simple like an ankle sprain.
Mm.
We 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 still get like a low back sprain, like they go, oh, I have my just hurt my back or something.
Okay.
Or they slept wrong. But majority of our pain patient is a chronic recurrent pain condition.
Oh, okay.
Mhm.
Yeah. All right. And then could you speak a little bit about what you consider Western medicine to be or biomedical medicine?
I think because as a scientist and engineer, I love Western medicine. Their advancement is just like amazing,
Yeah.
and especially the trauma care and then the emergency care is lovely.
Hmm.
But one downside I'm looking at, the patient in our community, the problem is a lot of actually problems, a chronic problem, chronic health disease, like let's say like a 6 out of 10.
Yeah.
So that is a little bit of a, I think we are having at this time the Western medicine, but I think the Western, I mean, I'm practicing in here, America. Actually, I get a lot of influence from Western medicine as well because I work with a lot of medical doctors.
Yeah. Yeah.
Mhm.
Wow. So when you work with Western medical doctors, do you reach out to them for like something that you need or advice or something that you feel your practice is lacking maybe, or do they reach out to you?
Well, actually, doctors are calling our clinic and then let us know what's going on with the patient because we are seeing patient and we try to improve their condition. And sometimes what I do, maybe I can do better at it, or maybe they don't know what I'm doing. And then, so our clinic, that's maybe most strong part of our practice is we are well communicate with the medical doctors. And as a one of a provider, we co-manage their care together. So I'm always sending report and then they reaching out and then ask about what the protocol is. And because we do a lot of infertility patient in our clinic,
Mm, yeah. Yeah.
maybe half of our case is like a fertility care. So we work with the infertility doctor very closely, and then we monitor all the condition. So we're like yeah, we always communicate each other.
Wow, that's fascinating.
Mhm.
Um, do you think what like strengths and weaknesses do you see between like Western medicine and Chinese medicine that kind of makes them work well together, if you have any of that?
That's difficult question. I the in my view, patient need both though. So this both medicine needs for this patient's more complete care at this time. And let's say, for example, I have a patient, she's getting surgery.
Mhm.
She tried, and then she's very active lifestyle, and then damage is already too much. So she's going through surgery. So yes,
Mhm.
but we do prepping to make their procedure more successful.
Okay.
And then after she's out from surgery, she still have a lot of a side effect, and then there's a scarring, and there's a huge rehab time.
Mhm.
Then we kicked in there, and then we make sure this wonderful technology from the Western medicine fully service her, and then also doesn't cause any side effect. And then we do those aspects, and then the doctors actually utilize post-op acupuncture a lot. So to me, let's say infertility. I
Mhm.
have a patient going through all this IVF cycle. Western medicine, like REI, constantly referring us before the IVF or not after, like a before IVF, let's say, or failed IVF.
Okay.
So Western medicine sometimes it fails. Actually, a lot of cases fails.
Yeah.
Then what's next?
Mm.
So we are trying to help each other. And so I think the not only that, like your doctors now, they are very smart, and then they're open-minded.
Mm.
So they actually see. I mean, I said that I studied with these doctors in the school, so they actually even learn. But if they not learn the acupuncture itself, but they believe in it and they see benefits through the over the years of the this like outcome and then patient feedback. So I think we are helping each other. Is the right answer?
Yeah. No, that's a great answer. That's very helpful. Very helpful. In those cases, are the treatments that you do like if an IVF fails, is are would you prescribe like acupuncture to the patient or herbs, or what would you normally
Good
like?
question. So acupuncture itself is very safe though. So even there in the active IVF hormone injection, we can freely use acupuncture.
Mm.
Herbs is slightly different because herbs is sometimes like they're some not all but some herbs has a like a hormone. They can influence some hormone level in the body. So we
Mhm.
are a little bit careful. So we might limit in the active IVF, or some doctor actually want it because if they go into we call there's different type of IVF cycle. Natural IVF, you are pretty much like a very minimal dose of medication or hormone, and then doctors find to use the herbs. So then we use herbs all the way to even transfer day. So they that's yeah, that's the way we're using it with the specifically for IVF cycle with acupuncture.
Wow, cool. All right, thank you. Um, New question. Do you think your Newport Beach location has anything to do with the sort of patients that you get, or their like openness to trying Eastern or Chinese medicine because of your location in Newport Beach?
Probably because the I think at the Newport Beach, community itself is very open-minded and it's very well-educated area. And if people compare with the, I mean, I'm not going to compare other country, other place. Just I'm just seeing the Newport Beach. People is very because they are a wealthy area, and the people are very focusing on wellness and the fitness.
Yeah.
So they spend more for their own health,
Yeah.
and I think acupuncture is one of them. And compare, because I've been practicing for last 18 years, and maybe like even 15 years ago and now, it's a huge difference.
Huh.
Huge difference, because I'm communicating with these medical doctors all the time, and like I have a lot of patients is actually physician in our clinic, and their staff, and they're very open minded. So
Mhm.
not only even overall country is more open minded, and Newport absolutely Southern California, because I think the population there's a lot of Asian community here too, and then that maybe have some but education, and then like a more like a preventive mindset of people.
Mm. Yeah, definitely. I would agree with you for sure.
Mhm.
Um, and more on your patients. Do your patients often become like regular patients that come in for scheduled treatments, or do you get more like the occasional patient will come in and then not really come back for a few weeks, or they won't return again, or do you have more regular patients, do you think?
Our patient is actually coming pretty frequently compared to other practice, because the reason is we do more like a fertility kind of work.
Mhm.
So we are talking about months and years
Okay.
treatment plan,
Yeah.
and then made people to come more frequently. But also we do a lot of chronic pain management.
Hmm.
But if it is acute case, you don't need to come that often. You come like a couple times, and then because it's just acute like a back problem for young people,
Sure.
you don't need a lot of treatment.
Hmm.
But we have also seasonal people like visiting Newport Beach for fun, and they want to doing something
Hmm.
different, and they want to get acupuncture. Then yes, one or two, that's it. Yeah, but our patient coming very routine and regular, very frequent visits actually.
Mm. Yeah. Okay. And then on your patients, do you normally use a combination of different Chinese or Oriental treatments, or more focus on just acupuncture first and then see later if they need more different treatments?
Um, we actually wanted to see which one works first.
Huh.
So we want to start something acupuncture first for more like a diagnostic, because we have to diagnose in our Oriental medicine as well. So if
Mhm.
the acupuncture point formula we put it is a correct or not, to see that we might have to start with the pure acupuncture, and then we later add it up, because then we confirmed our point is right in like a third or like a third fourth visit, a third or visit, we see, oh, this patient is getting better, then we know our diagnosis is right, so we can add it up more like a layer of a treatment to make a fast healing,
Oh, okay.
and instead of just dumping everything in and then try to more confused. And then I think so your answer, yes, we do a little bit of a step by step, like adding up later.
Okay. Okay. Good to know. And then what role does ear acupuncture play in your practice?
Say again.
Ear acupuncture?
Uh-huh.
Like, what role does that play in your practice, or
Oh,
why would someone get ear acupuncture as opposed to
oh,
normal
I
acupuncture?
love ear acupuncture. So the Oriental medicine is like there's a whole body. There's a lot of point in your body.
Yeah.
There's a major meridian, but the ear has its own, we call the microsystem. So
Okay.
they have their own point separate from whole body.
Ooh. Wow.
They have their own set of treatment. Some people does like let's say hand acupuncture, Korean hand acupuncture,
Mhm.
or but the reason I love about like this that we call the auricular therapy or ear acupuncture, there's a lot of study, because the acupuncture is one of the most studied area of holistic medicine in the, if you go like PubMed you can see it, but there's so many study done for ear acupuncture, and it's very effective for various conditions. So I use maybe whole some body acupuncture. Today I had a patient. Actually, I have to go house call. So she has a neck problem. So I did a acupuncture, but also I checked her ear because I'm layering one extra protocol. That's
Okay.
the ear acupuncture. And then this the reason I like it, very effective, and then you can find point right away. But also I can put something here and then it can continue. Acupuncture, you put the needle and you take it out.
Uh-huh.
But we can use the needle, but also we can use the pellet, a little tiny, because the crystal, and our website, like
I
we
saw
said a
the video.
crystal, yeah,
Yeah.
ball, and then because that kind of acupressure, so patient can do self treatment to do it like a couple days. Some people live for like a week
Hmm.
because
Wow.
it's a kind of sticker, like so it's a kind of acupressure ball
Yeah.
behind of the crystal.
Huh. Wow. That's very cool. Um, so does ear acupuncture, it has its own little system, right? So
On point and
oh,
on, yeah, it's
but
on point.
the
And
points that you reach here are different than the ones you're able to get at the rest of the body? Are they like new points or are they stronger?
um um no, they not, no, I think they are both good.
Hmm.
But as I said, when you go to acupuncture school, you want like a start with one theory because acupuncture is like a 3,000 years old.
Yeah.
Gotta be have a more than one theory how
Yeah.
to treat the people, and then all different region. Like a start from China and the Korea and Japan, and now French have own style, German have own style, British have their own style.
Oh.
So anyhow, so this is just another theory of the treating same part of the body.
Hmm.
So you can just have a more, like the acupuncture is the same thing. You can, like, I'm trying to this problem covering of here, but if I cover a couple more layer, I'm completely cover the condition and then more effective. So it adding up the effect of treatment, not necessary actually. Just body acupuncture is sometimes good enough, but this is just like an extra tool. I'm using it, and then I love it actually because it's very convenient and then pretty, and yeah.
Very cool. Wow. And last week in my class that this project is for, we read a document about acupuncture being used as anesthesia.
Hmm.
It numbs certain points. Do you do that practice? Have you heard of that?
Um, I don't, but some people actually do here for like a
Oh, okay. Wow.
dental procedure, and I think I still people try to. Like, I have a couple videos like they do open heart surgery, but I think it was a partially adding up procedure, saying like they may have a very low dose of a medication and then acupuncture to make less medication possible. And I have my teacher. He said that he had a two leg amputation for diabetic patient, the acupuncture only. Oh
Whoa.
wow. I'm not there yet, and then I don't plan to do so. But actually I met this nurse at the seminar. She was very first patient, had a C-section with only acupuncture anesthesia. She actually had in America. She was the very first case, and actually I met her in person. She said it's me.
Wow.
Some people really using it, but I mean I don't do. But you can, if you're looking at the insurance, uh, yesterday, I one patient came and then her coverage said acupuncture covered if this is in lieu of anesthesia.
Wow.
It was her policy. It
Wow.
was, but I don't do personally, and I admire some people do so. And my teacher always give me the point, but I didn't have to do.
That is fascinating. Wow. Yeah, when I read about it, I was shocked, but I thought it was so cool. Like, and I'm sure, yeah, it works. Wow.
Yeah, I mean there's a video you can actually Google. I might have it still, I guess.
Yeah, I'll look for it. Um, it is 7 o'clock, but I do have a few more questions if you're able to stay for a few more minutes.
Yeah, yeah, please.
Thank you so much. Um, okay, so what would you think an initial first consult with a patient look like? Like, how do you identify their disorder that they're dealing with, or do you listen to them tell you about it, or do you do like pulse diagnosis? I read about that in the class. Or what sort of things do you do to figure out what you need to do for them?
Lovely. So when patients come, the in Oriental medicine practitioner, we always see them first because they showing their symptoms.
Mm,
So they you looking at them,
okay.
and then also you hear maybe their breath, like how they talk and speech. So you hear them, but also you do pulse diagnosis. There is a point in both sides,
Mm,
and we can see specific organ function we call. So anyhow, that one also the tongue diagnosis is very effective tool we use. And in our clinic, we also use abdominal diagnosis. So the like some specific reflex point, and then the some part of a Korea, and then like a Japanese use a lot of that diagnostic tool. Some people use some part of the neck. There's so many different part. Or but most important is what the patients say about their problem is.
okay.
And then as a practitioner, we gather those data and then my own diagnosis, and then we put those puzzle together because they not only coming with the I have a back pain, but our questionnaire, and maybe you never saw our questionnaire, very extensive. So we see all those problems. Way we diagnose is we categorize or we see the pattern. We see the pattern of those symptoms, even they coming for back pain, and then we have a diagnosis for, let's say, specific organ related, and then we treat based on that diagnosis, not the patient's one symptom complaint.
Yeah. Wow. That's really cool. We read about it was called pattern differentiation and treatment determination, I think was the name. Yeah, so it's I'm not exactly clear on the meaning. Is it so you you identify like their symptoms, what they tell you, and what you gather, and then you like the patterns that you see in that you can attribute that to an illness that you know of or that you know how to treat. Is that and then you kind of you use the pattern that you see to and then apply it to the treatment that you know will fix it? Is that kind of
So
how it
the
works?
when we see the or let's say Oriental medicine, we're looking at like maybe like 8 different category.
Okay.
Is these people cold, or these people too excess, like too much things build up, or not enough? Or so we have some, or cold or hot, and then skinny, and all those tendency. And then we also put the organ in there because that's what the post diagnosis is, where the organ is related,
Mhm.
not only weakness. Then we have a acupuncture point suggestion, and then there's so many techniques out there, as I said, and then probably we use like 3 or 4 techniques per each treatment,
Mhm.
and then we combine that, putting in that our point formula for patients. So as soon as we differentiate in these people's body type and the condition and then the organ, and then it comes down to the specific diagnosis, and then we have all different point we can take it out from with that, because there's more than one point we can use. And
Mhm.
theory, it is a little bit complicated, but beauty of Oriental medicine is as soon as I diagnose it properly, then we always have solution for patient.
Mm.
Western medicine is different. Western medicine, you label patient with some diagnostic, whatever, you don't always have a treatment available.
Yeah.
That is so our patient, oh, finally, now I'm fibromyalgia. That's what they say. Yes, now I know I had autoimmune disease. Then what is a treatment? Like just a steroid, or like this medication works, or it's a huge difference. For Oriental medicine, as soon as we diagnose it properly, then we have a treatment laid out,
Mhm.
point, formula, everything laid out. So diagnosis is very important, proper diagnosis.
Wow. Thank you for that. That was so cool. And just to clarify, the points that you're talking about, um, are those like points like paths of treatment, or do you mean points like the acupuncture points? that you would use?
Acupuncture point.
Okay. Okay. Wow. All right, and then I just have a few more like broad questions. Just you've mentioned it before, but are there any other ways that you see Western medicine or Western medicine ideas influencing your practice at all?
Yes, especially. I'm keep just to remind you. Like I'm kind of emphasizing we are practicing like a heavy duty with our patient, the fertility patient.
Yes.
So they have their specific cycle,
Hmm.
and they come with all those medication and then like the phase of a treatment. So we customize with, okay, you are now priming with this birth control, now you're in the injection, and then you're testing, and then we actually go along to their treatment. We didn't do that before. Used to be like, okay, infertility, let's go this treatment, just the same for from start to end pretty much. But now with patient, like a patient coming with all this specific protocol they're going through, and
Hmm.
we have to understand, and we have to more customize for their specific needs. So we are very much influenced by the, especially for IVF or IUI patient, because
Hmm.
we changed the way we used to treat. But I think that it's serving patients better because the our goal is to make this IVF more successful instead of trying to do natural conception. Does it make sense?
Yeah, I think so. So what um, you said that you change the way that you treat it before. So what was could you remind me what the original way that you treat was before you had to change it?
I'm talking about more like infertility. Like it used to be like as I said, the we doing more like a Chinese medicine of a diagnosis we got from the patient's condition.
Hmm.
Then we go for, okay, she's a kidney deficiency. Let's make her adrenal gland and the kidney and then blood and everything, egg quality. We can just try to maximize. So then we go for that treatment
Okay.
with the acupuncture and herbology. But now she's going through IVF.
Hmm.
Okay, she's going through now hormone injection.
Hmm.
Because then we don't need to do too much what we did before. Now we try to help she doesn't get too much stimulated by this hormone. So we kind of help this specific care she's going through.
Hmm.
And then our point might different than what I used to do without this IVF protocol.
Oh,
But like let's say pain management influence of Western medicine. Um, well, probably. But we are still very mindful of what these patients are going through. We have a lot of patients going through like hormone, not IVF, like let's say thyroid problem. We
mhm,
see a lot of hypothyroid in our patient, and if they are in specific protocol, then we limit us with the only acupuncture, and we don't interfere with the herbology much, and then we go more lifestyle. We choose maybe food choice, so that we got a little influenced by what they are doing right now because we don't want any like interfering and contraindicated what they're going through right now.
mhm,
Does it
mhm.
make sense?
Yeah, yeah, that does. Thank you. Um, and then just a general question. In what way do you think acupuncture reflects Chinese medicinal values and knowledge? Like um, how does acupuncture kind of represent Chinese medicine, or what parts of it really reflect what you consider Chinese medicine to be? If that makes sense, I can try clear it up again if it doesn't.
The traditional Chinese medicine focusing on a lot of gut related problems,
Mm.
and then also the human mind.
Okay.
So there may be um, the Chinese medicine or acupuncture itself, looking at the whole person, as you said initially,
Hmm.
but we never let this spirit or mindset go. We always kept it in our medicine. They are going through all these physical problems, and then a lot of times is engaged in their own struggle or emotion together. So the emotion part is a huge, heavy duty our diagnostic like a diagnostic tool or our treatment plan. So
Mm.
that's maybe beauty of Chinese medicine or acupuncture. We're not only looking at the physical body, we're looking at your other emotional or spiritual body same time together and try to combine that treatment to heal.
Okay. Yeah. Does the spiritual body, does that, because we've talked in my class, we've talked about cosmology and kind of the heavens and spirits and ancestors, and it is getting into like ancient Chinese medicine, but also like the influence of yin and yang and like qi. Is that sort of what you're talking about with the mind and the spirit essence that's included?
Uh, Qi, yin and yang, probably not. But when I say like a spiritual, it's more towards like their their mind. But yes, that's we always like that's a acupuncture 101 or like 1 2 3. Like okay, where's yin and yang, and then what
Yeah.
type of spirit? There's a different type of spirit. So it's exactly. So that I think we, especially in now, you say like anxiety in Newport Beach. So we try to all fix this with the energy meridian, but where is your spirit and then your mind?
Yeah.
So we try to just put it together. And I
Yeah.
think it's a very missing part of a Western medicine at this time.
Yeah. Yeah.
And that's what the acupuncture or Oriental medicine is heavily looking at as very important part of healing.
Wow. Awesome. Thank you. All right, last question. How do you think acupuncture has changed in the past decades or years, or more broadly since like its beginnings, or what you know from how it started until the modern version of acupuncture, or even in your practice in the past like 18 years that you've had your practice? Have you seen the practice of acupuncture itself change in any way?
There's some change. So the even acupuncturist is a generalist
Mm.
technically. We see every condition. But now, like I do a lot of reproductive medicine, and some people does like a sports medicine. So even inside of acupuncture, it's like a little bit of like a Western medicine. People try to go more a little bit of a specialized care,
Okay.
and hope is not too much like Western medicine does. But in I'm seeing as the sort of a trend at here right now in the Western medicine, and also not only in the Oriental medicine field, like I do a lot of functional medicine, like a lifestyle.
Hmm.
I'm trying to help my patient with a more ancient wisdom or medicine part, but they live in here 2020, and I have to understand and I have to help them out what they can help themselves. So more lifestyle, and then just basically the sleeping or drinking and all those with the, even I do actually a lot of supplement, or even I order a couple of testing to see what other thing I'm missing. So that combined care I'm seeing more in Oriental medicine field like the last 10 years. So I think it's a good, as I said, hopefully it's not like a, hope we don't lose our spirit, like our soul, like the pure Oriental medicine, but still having some a little more extra tool in their toolbox.
Okay. Wow. Very cool. Wonderful. Thank you so much. That's the end of my questions. I really want to thank you just greatly. This was amazing, and this is going to help me so much. Your answers were amazing. Um, yeah, just many, many thanks to you, and thank you for your time. I know your time is important. Thank you so much, Dr. Lee.
I appreciate it. Good luck. You're amazing. I'm proud of you, Kimrena.
Thank you, thank you. I will send you the recording.